Hello, here is Jochen Schachenreiter speaking. I'm a medical doctor, ENT surgeon in Graz, Austria. We present a study about 3D models of the nose and the paranasal sinuses, called in this paper PNS, created with rhinodiagnost service before and after FESS. Now, the aim of our study was to associate the physiological understanding of the ciliary movement and the ventilation in the paranasal sinuses. With computational fluid dynamics, we can show that all parts of the paranasal sinuses are ventilated, but only 1 to 3% of the nose's flow is going through the ostiums of the PNS. Now to the history of FESS, of this Austrian endoscopic founding. In the early 70s of the last century, Messerglinger and Stamberger founded the concept for the functional endoscopic surgery, now called worldwide FESS. This concept was based on the understanding of the physiology only of the ciliary movement in the paranasal sinuses. Computational fluid dynamics simulations require a sophisticated data preparation process beforehand. The workflow of this process starts with the acquisition of CT images with DICOM formatted. To achieve a high-quality 3D model, it's necessary to use slices with a thickness of around 0.6 millimeters. But only Excel slices are needed, which can upload it over the internet, online, or via a storage medium. Three D models are generated in minutes using a convolutional neural network. The generation process of 3D model is controlled by different parameters. Laplace transformations for smoothing the shape of the nasal cavities or maximum number of triangles faces which constitute the Furser's mesh. This process takes around 3 to 5 minutes on a standard PC when using around 200 DICOM slices. Doing a two-class image segmentation, which separates air from non-air parts, delivers an accuracy of over 99% compared to human segmentation where the CNN is used. The errors on these slides points to thin parts of bone elements. Now to the post-processing to improve CNN output. 3D models are generated by a convolutional neural network. Problems arise only when identifying different nasal cavities. Multi-class image segmentation, then post-processing is necessary. This slide presents different views, including the original CT scans. So we can combine the two-dimensional CTs with the three-dimensional rhinodiagnost volumen presentation. Now, for example, I show you the view from the sinus maxillaris at the left side into the medial part of the nose, And at the right side, you have the view from the medial part of the nose into the sinus maxillary. With rhinodiagnost 3-dimensional 3D, the rhinosurgeon is better prepared for the FESS, especially for the anatomic structure of the paranasal sinuses, including all the osteums. Therefore, we think that we can follow the concept for FESS in an improved quality. Thank you. Nice greetings from Austria.